Welcome back. According to court documents, a high-level official from the Quebec Ministry of Health concedes that Quebec's medical imaging system is on the brink of collapse, and this for several years now. This raises significant questions about a key component of our healthcare system. To tell us more, happy to be joined by Dr. Laura Sang. She is a family doctor here in Montreal. Dr. Sang, thank you for joining us this morning.
Hi, thank you for having me.
So first of all, I think most of us kind of know what medical imaging is, but why don't you tell us, why don't you set us straight on what is medical imaging in the healthcare profession?
So medical imaging is any series of imaging that we order for diagnostic or prognostic testing. This can include X-rays, ultrasounds, CT scans, MRIs, other specialized tests like PET scans, etc.
And so in daily practice, how is it omnipresent? I suspect that this is in use every day, everywhere, in all kinds of situations, right?
Yeah, so I have a lot of, older patients and people who used to work in construction. I have a lot of people that see me for low back pain. Mm-hmm. So I'm constantly sending requests for CT scans and MRIs of the spine and other areas. Some of my patients that are starting to have cognitive things, you want to make sure that there's nothing going on organically. So you want to do, CT heads, that sort of thing. And then, of course, I also work in a rehab center, and a lot of patients have had strokes. So you need that imaging to make sure that someone isn't having a stroke. And if they are, that you can manage them appropriately depending on what the imaging findings are. So, yeah, these things are used in a variety of situations, both urgent and non-urgent. But the patient experience is always, I just can't wait to find out what's going on so that I can know what the next steps are in my treatment. I know for a lot of people that waiting and that uncertainty of when I'm going to get my answers can cause a lot of distress outside of the illness they're already experiencing.
So this court document that was revealed in a Journal de Montréal article, this is part of a court case, a very complex case about contracts and who should be modernizing our medical imaging system. But throughout that court case, so this document that is signed by a very high-ranking official in Quebec's health department that concedes that it's been the medical imaging system in Quebec has been outdated since 2014. It's on the brink of collapse. It's outdated, fragile, frequently breaks down. Is that your experience with the system in our healthcare network?
Yes. So I think that it doesn't always make it back to patients. It's more that they're just not always contacted in the delay that was specified. Mm-hmm. But I get regular emails being like, oh, we can't do this imaging, or, oh, this machine is down, or there's a temporary shortage of this. I know, I think about a year ago, I had gotten a letter that there was an MRI machine that had an issue. So anyone who had an MRI during X number of years may need a repeat MRI depending on what the pathology being investigated was. Mm-hmm. I know that there are certain studies that when I set up shop 2 or 3 years ago, like, barium swallow to look for dysphagia, now that's not offered anymore. I don't know if that has to do with a lack of equipment or a lack of personnel. Mm-hmm. But on the daily, I am seeing wait times are longer for, the imaging tests that I'm ordering. And I don't know how much of it is just the backlog and the flood of people needing more imaging, and how much is from the, machines breaking down and going offline. And I think it's some sort of combination of the two. Mm-hmm. But to answer your question, yes, I am seeing delays from that. I do get emails about that somewhat regularly.
And do you talk to these technicians? Colleagues in the medical profession? I mean, is this something that is a concern? Because when I read this article and I read that even within the Ministry of Health and at the highest levels, they're saying this has been an emergency since 2014. We're 10 years into this situation. Nothing's been done. Are there any types of discussions about this, about why and how come we've gotten to this point?
I think that we're more focused on making sure that our patients are
Right.
getting the care that they need. So sometimes I'll have a discussion with a colleague being like, hey, I'm suspecting this pathology. I know that an MRI would be best for this, but I think they would get a CT scan faster. What do you think on that? So I think it's more about trying to use whatever we have access to get the answers as much as possible and sort of, overcome some of those challenges. Once it goes beyond patient care, I think that we're somewhat removed because we're
Sure.
just trying to
You're
hold
just trying to
everything
find a
together on the
solution.
front line.
Yeah, that's it. You're
Yeah.
you're just trying to do what you can to get a result. So, is there a private sector solution to that, or you're just locked into whatever the public sector offers you?
So most of my patients can't afford imaging in the private system. Those that can through insurance or other means, especially when it comes to like knee injuries and they're athletic, they want to get back into that their physical activity, they'll go private. But that is not a luxury that most of the population has access to, and I don't know how available those things are to the general population outside of my patient population. I don't think that that's the answer because, all of our hospitalist care is still public. And, I think it's people who are in a more vulnerable state that might be at the most risk, the people who need urgent imaging. If that capacity to provide that imaging isn't there, we're talking more about rural medicine at this point.
Well, that was my next question, Dr. Sang. What would happen? Let's say, and by no means am I wishing for this at all, knocking on wood, this would not happen. But let's say tomorrow you just get from the health ministry, you're saying, you know what, it's no longer available. What would be the impact of not having access to medical imaging?
Well, I mean, I don't think we would lose all imaging all at once.
Okay.
But I think in the past, what's happened is we had to transfer patients to other areas to get that specific imaging done. We already do that. For example, some of the patients that are unable to fit in the MRI machines that we have available may be sent to another center that has more accommodating machines. So we're already used to transferring people for other reasons, but I think if ever there was some sort of catastrophic event, we would be shipping people off to different places, which would congest those areas even more and limit the access. We try to have people get investigations and consults done in their region to make sure that we're spreading out the resources accordingly and that people get care close to home and are, that the resources are distributed evenly throughout the population. And I think if we had these big, shutdowns, that it would just be even longer delays because you have more people trying to use the same one resource.
Well, let's hope that this situation finds some sort of resolution quickly. For now, you're coping. That's what I'm hearing. You're finding, you and your colleagues are finding ways to cope with this situation.
But it takes a lot of time and manpower. So if that imaging isn't offered in the time frame that I want or at the hospital that I want, I have to start searching around, okay, what hospitals will do it? I have to ask my secretaries, oh, no, they can't go there. Oh, the patient can't get adapted transport to go there. Oh, no, you can't see this one that's outside of their region.
Right.
So it becomes complicated. And they've changed the way that we order imaging as well through this centralized system. And if the exact thing that we're not looking for is there, we have to sort of do a whole bunch of extra work to bypass it. Just the way that we order imaging has changed and become more complicated and more time-consuming, let alone actually getting the imaging. So there's just a larger administrative load that falls on us trying to compensate.
And that's all time that is not spent on actual healthcare.
Absolutely.
Oh, wow. Anyways, I really hope the government gets its act together on this one. And since 2014, I can't believe it. Dr. Sang, really appreciate your perspective this morning. Thank you.
Thank you.
Dr. Laura Sang is a family doctor in Montreal.